Kong Free Press. First of all, will the government consider providing a third booster shot vaccine or allowing those who got Sinovac to mix vaccines? And second of all, the government has declared the fourth wave over, but has now tightened travel rules and extended social distancing. With compulsory masks, 4-person limits, and travel quarantine for vaccinated citizens, do you fear there's a risk of causing resentment or that people will stop complying when the infection rate is so low? Thank you.
Well, I'll answer the second question and invite the Secretary for Food and Health to address the question about providing a third dose. As I have called this presentation, it is aiming to build a double barrier for Hong Kong to fight the COVID-19 situation, because there is simply no room for complacency, despite the fact that we have achieved 0 local confirmed cases for 56 days. Because Hong Kong is a very well-connected international city. So the world around us is facing this challenge of another major rebound, as you can see from the 7-day moving average that I have shown you. So with that in mind, if we start to relax or to open our borders without subjecting passengers arriving Hong Kong to any quarantine, then we are putting the whole community at risk. We are sort of defeating the many, many efforts made by many, many people over many, many months in fighting the COVID-19. So we have to continue to remain very vigilant and to adopt the effective measures that we have been adopting. But at the same time, we try to rationalize, for example, reclassifying the countries according to the level of risk and making a difference or differentiating between those who have been fully vaccinated and those who have not. So I would describe all this as being a more sophisticated approach to ensure border controls. Similarly, for social distancing, we have been adopting a very prudent but also very sophisticated approach to allow the different types of businesses to resume their operations in the past 3 months. And the effects are very visible. As you can see, there are a lot of activities going on, that the restaurants are more or less full and people are going to various activities. So again, this is not the time to relax. Otherwise, we will be putting Hong Kong people at risk. And I hope and I appeal to people of Hong Kong to continue to adopt their very cooperative, very compliance approach in wearing the mask on most occasions, and also adopting the public health measures and avoid big crowds in order to keep the city safe. Professor Chen.
Okay, thank you. Regarding the third dose, actually our Joint Scientific Committee under the Center for Health Protection has had its initial discussion on this topic. Initially, I think they are looking for more data, whether they would have more data from the local research as well as from overseas data, and also any recommendation from the WHO, World Health Organization, regarding the third dose or the booster dose. So initially, I think the initial discussion is that there is no urgency for the general public who have been vaccinated to receive the third dose. But if they get more data, they would further look into whether there is a need for those immunocompromised patients or high-risk patients to receive the third dose. And also, what is the appropriate period in between the second dose and also third dose. So they are looking into various details about if we are to have the third dose, how are we going to administer, how are we going to do it, who will be eligible, and also the period in between. So they are still now collecting more data, and further discussion will be ongoing in the Joint Scientific Committee.